CSS has a tremendous gift in being able to serve those that need the highest level of care. A whole person approach to care is really looking at the person as a whole. So it is holistic. It takes into consideration a lot of the social determinants of health.
Sometimes folks that have mental health issues don't start seeing those actually come out and impact negatively their lives until they reach a certain age. They get into their late teens, early 20s, and those folks then start having debilitating mental health issues.
My initial diagnosis was bipolar when I was 15. At 15, I started hurting myself, and they put me in the hospital, and I ended up being institutionalized for 3 years until I was 18. I was sent from place to place to place, but it was because with the type of mental illness I have, sometimes I hear things, and sometimes it makes me want to self-harm or gives me thoughts about not wanting to be here anymore. And usually when that happens, I seek help, and I get the help I need, and then I go right back to functioning normally.
That's why we have the integrated care, so that we can treat them not just as a mind alone, but a mind and a body.
The benefit to a client having services all under one roof is that they're able to build a relationship with the staff, so that they're familiar and comfortable coming back in. Individuals with mental illness often feel afraid in terms of stigma going out into the community. So if they're able to come to primary care, psychiatry, pharmacy, lab, all in one place, they're more likely to return and to really engage in their services.
There's a lot of good people here. A lot of people care. My psychiatrist is awesome. My peer support is awesome. I have good relationships with them. They help to meet my needs in the community as well as my mental health needs. And I think CSS is an awesome place to come. There's a lot of good people here.
We do a lot of outpatient office visits. And so where we're seeing people on a regular basis, many of our clients have chronic conditions that they're being managed for, diabetes, hypertension, COPD. And so we see them on a regular basis for follow-up and maintenance. And we also see a lot in podiatry. And then, of course, our psychiatry clinics, where we have crossover between those clinics.
We recently decided to expand on our geriatric services. That's something that we are growing, and we decided that loneliness is something that's a real concern with older adults. We had the case managers bring in a client from their homes to have an outdoor picnic, and it was just something that they would never have done on their own and may never have done before. And I just felt like we did that for them, and maybe then they'll meet somebody or feel a little more comfortable to go to the next activity.
I want clients to know that there isn't any service that they would need that we couldn't figure out how to help them. So if they have a need that we can't meet here, we do a lot of work around coordinating connection to services with other entities in the community. So it doesn't mean that they have to leave their services here, but as we get to know them or their needs change over time, we're able to add on more services, make referrals, and connect them to additional supportive services in the community as well.
I'm finally on the right meds, and I'm sleeping sound, and I'm getting up in the morning, and I'm functioning, and I'm not having crisis after crisis. I used to be in crisis all the time, and now it's not like that anymore. I can actually live my life without mental illness being a bad thing in my life anymore. It's who I am, but there's other things in your life besides having a mental illness. I wouldn't be here if it wasn't for CSS, because where I was before, they didn't treat me for suicide attempts and self-harm, and it was really dangerous. But CSS treats me accordingly to what I need at the time, and that has had a big impact.